patient's gait seems normal. She does not seem malnourished. She seems very hydrated. Skin color is appropriate for race. Posture seems good. Everything seems normal. Okay. Miss Kristen, hi, I'm going to be your student nurse today. I'm Darian. I'm with Winston-Salem State University. Could you tell me your name and date of birth?
Sure, my name is Krista Dawkins and my birthday is August 3rd, 1998.
Okay. Patient's speech is normal and she is alert and oriented and she can comprehend. Can you sit on the examination table for me, please?
Sure.
Okay. Do you know where you are today?
Yes, I am in the doctor's office.
Okay, do you know what year it is, what month, day?
It is July 9th, 2019.
Okay, do you know who the president is?
I'm Donald Trump.
And do you know your name?
Yes.
Okay, patient is alert and oriented times 4. I'm going to provide privacy and I'm going to do hand hygiene. Okay, Ms. Dawkins, today we're going to do a physical head to toe examination on you. Are you experiencing any pain?
No.
Okay, patient's facial features seem normal. Okay, tell me if you feel any pain while I do this exam, okay?
Okay.
I'm going to start with assessing your hand and nails. Can I see your hand, please?
Sure.
Okay. Hand is warm and dry. It is also smooth. There appears to be no lesions. Can I see your other hand? No lesions on this hand. Still warm and dry and smooth. I'm going to check your skin turgor, okay? So I'm going to pinch it a little. Okay, turgor is good. There is no dehydration. Okay, now I'm going to check your nails. There seems to be no clubbing. Can I see this hand? No clubbing in your nails. Okay, now I'm going to check your capillary refill. It might be a little pinch, but it'll be fine. Okay. Capillary refill in left hand is less than 3 seconds. Capillary refill in right hand is less than 3 seconds. I'm going to be assessing your face and head. Is that all right with you?
Mm-hmm.
Okay. I touch it. Okay. Face is warm and dry. Your face seems to be symmetrical. Your head is normal. It seems to be normal cephalic. If I could access your scalp, you can do that for me, please. Okay. Scalp seems to be moist and oily. I don't see any alopecia. Hair seems to be thick and full. You can sit up for me, please. Okay, I'm going to assess your cranial nerve 7, which is your facial nerve. Can you smile for me? Can you frown? Can you puff out your cheeks? Can you grit your teeth? Okay, facial nerve seems to be good. Okay, I'm going to check your temporal artery. Artery seems to be bilateral and 2+. Okay, now I'm going to assess your eyes. Do you want any glasses or contacts?
I'm over glasses.
Okay, do you have your glasses with you?
No.
All right. Eyebrows seem to be full and thick. Eyelashes are thick, healthy, and long. There's no ptosis of your eyes, no drooping, no crustation or anything. Can you put on your conjunctiva and look up for me, please? Okay, conjunctiva is pink and clear. Sclera is white, no redness, no lesions. Iris seems to be dark brown. Okay. Pupils seem to be 3 millimeters equally on both eyes. Okay. Now I'm going to assess your pupil reaction to light. Okay, left pupil has constricted to 2 millimeters. Okay, right pupil has constricted to 2 millimeters. Okay, now I'm going to assess your accommodation. If you could focus on this for me, please. Okay, pupils are equal, round, react to light, and they are accommodated. Okay, now I'm going to be checking your ears. Do you feel any tenderness?
No.
Okay. Okay, ears seem to be fine. I do notice a piercing. Tympanic membrane is pearly gray. The ears are symmetrical. Let me check this ear. Okay, any tenderness? Okay. I see no lesions, redness, or anything. Tympanic membrane is also pearly gray for this ear. Okay, now I'm going to do a voice test. Can you occlude one of your ears for me, please? Okay, I'm going to stand behind you. Okay, it's a whisper test. Okay, tell me when you hear what I say, okay?
Pig. Cow. Horse.
Okay, now can you occlude the other ear, and I'm going to test your other ear. Are you ready?
Yes. Donkey. Snake. Horse.
Okay. Your hearing seems to be good from the voice test. Now I'm going to check your nose. Is that all right with you?
Mhm.
Okay. Your nose seems to be midline and symmetrical. Let me see your septum. Can you tilt your head up a little for me, please? Okay. It seems to be no deviation of the septum. Can you occlude one of your nostrils? Can you breathe out of your nose for me? Okay. Is it normal? Do it one more time. Okay. Can you do the other nostril? Okay, your nostrils seem to be patent. All right. Okay, I'm going to be assessing your mouth and throat. Your lips seem to be symmetrical and midline. Can you show me your mucosa, please? Okay, it seems to be moist and pink, no lesions or anything like that. Can I see the inside of your mouth, please? Okay. Buccal mucosa is also moist and pink. Can I see your gums? Gums are also pink. I see no missing teeth or anything. Okay. If you could stick out your tongue for me, please. Okay, tongue is symmetric and midline. I'm going to check your gag reflex if that's all right with you. Okay, gag reflex is intact. Tonsils appear to be missing, so that would be a 0. Did you have your tonsils taken out?
Yes.
Okay. Can you say ah for me? Okay. Uvula is midline. Uvula is off palate, also moved bilaterally, so cranial nerve 9 and 10 are intact. Can you stick your tongue out? Can you move it around? Okay. Cranial nerve 12 seems to be intact. Okay, Kristen, now I'm going to assess your neck. Can you look up for me? Okay, it looks symmetrical. I see no masses. Does this feel tender?
No.
Anything? No, I don't feel any tenderness. Do you have any pain? No? Okay. Your trachea seems midline. Could you swallow for me? Okay, it's intact. Okay, I'm going to check your carotid pulse. Okay, I'm going to check it on this side. Okay, it's 2+ bilaterally. I'm going to listen for any bruits. I'm going to listen with the bell of my stethoscope. Okay, I don't hear any bruits in either pulse. Okay, now I'm going to check the range of motion of your neck. Could you put your chin to your chest for me? Okay, can you put your head back? And can you go side to side? Okay, your range of motion seems to be good. Okay, now I'm going to assess your cervical lymph nodes. Tell me if this causes you any pain. Okay. This is your preauricular. postauricular, your occipital, your submental, your submandibular, your jugulodigastric. Okay. Now I'm going to check your superficial cervical, your deep cervical chain, your posterior cervical. Okay, can you hunch your shoulders for me, please? Okay, and your supraclavicular. Okay, the notes I did feel were palpable and movable and soft. I didn't find any abnormalities. Everything seems good. Okay, now I'm going to assess your posterior chest. Okay, your thoracic cage configuration is 2-to-1. It seems to be normal. Okay, I see no lesions, mild discoloration, mild striae. Do you have any pain or tenderness anywhere?
No.
Okay. Okay, now I'm going to assess your expansion. Okay, can you take a deep breath for me? Okay, expansion is normal. Now I'm going to check your bronchophony or your tactile fremitus. Could you say 99 for me?
99.
Keep saying it.
99. 99.
Okay. Now I'm going to listen to your breath sounds. If you could take a deep breath for me, please. Okay, everything appears to be normal. Okay, your breath sounds are normal on inspiration and expiration. If I can get you to stand up for me, please. I'm going to assess your spine. Okay, could you bend over for me, please? Okay, spinous processes appear to be normal. Spine is midline. There's no scoliosis. Okay, you can stand up for me. All right, thank you. Okay, Miss Kristen, now I'm going to assess your anterior chest. All right. Your respiration seems to be normal. There's no labored breathing. Do you have any problems breathing?
No.
Okay. Your skin, there might be some mild discoloration and striae. I see no rashes or lesions or redness. Okay, I'm going to listen to your chest. If you could take a deep breath for me, please. Breathing seems to be normal. There's no labored breathing or anything. I don't hear anything irregular in your inspirations or expirations. Okay, now I'm going to assess your range of motion of your upper extremities and your muscle strength. Could you do what I'm doing, please? Okay, we're going to abduct our arms. We're going to adduct them. Okay, extend. Right, flex. So your range of motion seems to be all right. Could you rotate your arm? There's no pain or anything, is there?
No.
All right. Now could you grip my hands? Okay. Now can you press against while I push down? Can you push up? Okay. Push down. Okay, your muscle strength seems to be intact. There's no fatigue, no problems. So now we're going to examine your breast. Do you do breast self-examinations at home?
No.
Okay, well, you do them 4 to 7 days after the start of your menstrual cycle, okay? So I'm going to teach you how to do it. What you have to do is raise your arm, okay? We're going to start at the toe of Sphinx, which is right under your axilla, inside of your axilla, okay? We're going to go down to the bottom of your breast, then up like a zigzag, okay? And do you feel any lumps or anything? Any dimpling? Tenderness? Okay. So we're going to do this until we reach the midline. Okay. Did everything seem normal? Okay, that's all right. Now I'm going to auscultate your heart and listen to your heart sounds. Okay, we're going to start with the aortic. Okay, now we're going to move on to the pulmonic. Okay, now we're going to go to tricuspid. Okay, and then we're going to do the mitral. Okay. Everything sounds normal. Your heart, I heard the S1 and the S2. They both sound like they're intact. There's no deformities or anything or any irregularities. So everything seems perfect, Miss Kristen. Okay, Miss Kristen, now I'm going to assess your abdomen. Is it okay if I expose it? Okay. If you feel any pain or anything throughout this, please tell me. Are you feeling any pain already?
No.
Okay. Okay. Abdomen seems to be rounded. Okay, there is slight discoloration in striae. There's also some hair in the midline above the inguinal region. Okay, now I'm going to listen to your bowel sounds. Okay, bowel sound seems to be normal active. Your inguinal region is midline. I see no pulsations anywhere. Okay, now I'm also going to listen to your arteries. Okay, I'm going to listen to your aorta. Okay, now I'm going to listen to your renal artery. Okay, now I'm going to listen to your iliac artery. Okay, your arteries seems to be fine. Okay, now I'm going to teach you how to check for your femoral pulse and your inguinal nose. So what you want to do is open your leg and you want to feel right here. Okay, and you're going to feel for the pulsation, all right? Okay, and for your inguinal nose, they're just going to be right above your inguinal area. Okay, you feel them?
Yeah.
Okay. Okay, Kristen, now I'm going to assess your lower extremities. Okay, everything seems to be symmetric. I see mild discoloration in your lower leg. There is some hair. I don't see any lesions or redness or anything. Skin feels warm and dry. I don't see any inflammation or edema. Okay, everything seems to be normal. Okay, could you abduct your lower extremities for me, please? Are you having any pain?
No.
Okay, so you just did abduction and adduction. Could you flex your legs for me, please?
Both.
Could you extend them? Okay. Now could you sit on the side of the bed for me? Can you invert your feet for me, please? Okay, can you evert them? Okay, can you plantar flex your feet? Okay, can you dorsiflex your feet? Okay, your range of motion seems to be great. Okay, now I'm going to assess your pulses of your lower extremity. I'm going to assess your posterior tibial pulse. Okay. Okay, seems to be normal. Now I'm going to assess your dorsalis pedis. Okay, it's normal. Your feet appear to be warm and dry. Your legs do also. Okay, still warm and dry. Okay, I see no lesions, no redness, no inflammation. Now I'm going to check for post-tibial edema, tibial edema. Okay, I see no swelling or edema. Okay, everything seems to be intact. Now I'm going to assess your range of motion and your muscle strength. Could you push against my hands for me? Okay, muscle strength is intact. Okay, could you stand up for me, please? Okay, okay, we're gonna do the range of motion of your hip. Can you extend your hip for me, please? Okay, could you flex it? Could you abduct and adduct? Okay, can you do the same to the next leg, please? Okay, we're gonna extend, flex, abduct, and adduct. Okay, now we're going to do the range of motion of your knees. Okay, we're also going to extend, flex, and hyperextend. Okay, now can you do that with your other leg also? We're going to extend, flex, and hyperextend. Okay. Now I'm going to move on to your neurologic system. As we've seen earlier, you are ×4 of level of consciousness. Do you feel any numbness or tingling in your arms or anything?
No.
Okay, how about your legs and feet?
No.
Okay. Okay, now can you balance on one leg for me, please? Okay, can you do it on the other? All right, you have good balance. Now can you close your eyes and touch your nose for me? Can you do it with the other hand? Okay, thank you. Now we're going to move on to your musculoskeletal system. Could you walk across the room? Okay, your gait seems to be fine. Can you touch your toes for me, please? Okay, now can you stand and can you move your spine from side to side, back and forth? Okay, everything seems to be normal with your musculoskeletal system.
2, 3.
Okay, Kristen, thank you so much for your time and your cooperation and your patience with me. I've had fun while I'm examining you. Now you can put your clothes on, and I hope you have a great rest of your day.